My next guest has never been on my show before, but he did have somebody that was along a couple of years ago that had a service like he does. Tim Terrell, and he is the owner of ArcPoint Labs in Scottsdale. Welcome to the show.
Thanks, Carol. It's good to be here.
Now, I want you to talk a little bit about what ArcPoint Labs is.
We are a toxicology and clinical laboratory primarily. So it means we do all kinds of drug and alcohol testing. We do immunizations, blood draws of any kind, food sensitivity testing, about 10 types of DNA testing, many different lab tests.
What area do you service?
I service the North Valley and the West Valley. The other ArcPoint owner in the Valley serves the Central and East Valleys, and we collaborate, and together we serve the entire valley.
Right. Now, when I'm listening to that, I'm thinking, I'm just an individual. Can I just come to you? What do I need to get to you other than to call you and say, I need my blood drawn? Can I come to you for that?
Yes, we do blood draws Monday through Friday at about 2 p.m. because we don't want weekend blood sitting somewhere. But we do drug and alcohol testing 24/7. You can walk in, or we'll do it on site or in our lab.
Okay, so your number to call you is 602-892-4599. The website is arcpointlabs.com. It's /Scottsdale-North. Got it? Right?
Correct.
I'm right. Now, I want to talk to you about that person that's calling, because before you came on, you had mentioned that you are doing these, and I know you do a lot, so we're going to try to get to everything here. But on that, there's a reason why people are coming to you to have this done, because their deductibles are so high, they're paying it out of, are you better? How does that work?
Well, we offer a cost-effective blood draw option. So we do not do the insurance reimbursement. We will give the paperwork to people to submit their own claim. 20 years ago, we all used to submit our own claims, and these days we've gotten used to having our physician or lab or a pharmacy submit it directly. So in this day of high copays, high deductibles, it's common, especially if people know what they need or if they have a doctor's order, they just call up or walk in and get their blood draw. We give them the results, send it to their physician if they wish, or anyone else.
Now, why did you get into this business?
Well, for several reasons. I'd been in other businesses in the past, and I'd built other businesses. And one is I wanted to do something closer to home to help serve the community. I wanted to get off the road. I was traveling a lot. Also, my wife and I wanted a business that could be more of a legacy business. Our daughter is an experienced RN. She's our lab manager, and someday she may want to take over the business.
Yeah, it is something that somebody can get into. It's a franchise, right?
Yes, there are over 90 locations around the country, and we have affiliated collection sites of about 2,300 around the U.S.
And you have some more that you're opening, you said?
Yes, I'll be opening at least 2 more. My fellow franchisee here has 2 labs open. He's opening, I think, 4 more. So we'll have at least 9 in the valley before too long.
Wow. So now you also do something with very creative, very great value for employers. Okay? Please tell us a little bit about what that is.
Well, we have a couple of different programs. One of the things that we do is offer a service to employers or to consumers called ArcPoint MD, which is a comprehensive telehealth program that's $18 per month per household with no consultation fee, and it comes with a discount prescription card that saves anywhere from 10% to 85% off retail value for prescriptions. That's one service. Another one is that we do all kinds of pre-employment and post-employment drug and alcohol testing to improve efficiency, reduce claims, lower workers' comp premiums, things of that nature. We also offer another test through employers, especially self-insured employers, or to consumers, or through physicians, called pharmacogenetics. And that's a DNA test that takes a trial and error out of prescription medication. So we take a DNA sample. It's an oral swab, 45 seconds inside each cheek, and we test your DNA against over 125 common prescriptions and are able to tell you and your physicians which prescriptions work on you, which ones don't work at all, and which ones have to be prescribed at a certain dosage level in order to work. So we're taking the trial and error out of prescription meds. About the fourth leading cause of death in the U.S. is adverse drug reactions. About a third of those are caused by drug genetic conflicts as opposed to drug-to-drug conflicts.
Wow, that's awesome. It's very cool that you can do that. I know so many people have reactions to drugs. Okay, but you also said today that you were going to offer the audience, you have anyone who is an employer, that you have a candidate resource assessment. What is that?
Well, it's a behavioral assessment. Most companies would use it for executives or sales staff. And I've used it myself and other companies in the past, but it basically helps you determine if the personality and behavioral traits of the individual match the job description. And so as we get older, or sometimes people are very good at covering up their faults, but if you take this behavioral assessment, they all come out, and it allows the employer to make an informed decision about their hire, especially someone who's going to impact the bottom line of the business quite a bit. And so they can tell if they fit the job description or not.
Well, we're going to open up the lines for everyone to get that. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Their phone number is 602-892-4599. It's ArcPoint Labs with an S. It's .com/Scottsdale-North. Okay, let's go on here. Okay, a lot of people, they take drug tests for many reasons, not just to find out if they're on drugs. There's drugs that they need to, the people that are taking a job, that if they've done that, they don't want that kind of employee, right? How
Correct.
easy is it to fail a urine test?
Well, we normally can see anywhere from 6% to 12% failure rate. There are people who are drug users who know how to get around urine tests.
Can they?
Yes, they can. We do a lot of things to help prevent that. But
Stand
it
and
is
watch.
possible. So yeah, we test color, clarity, odor. We test for adulteration on samples, so pH, specific gravity, creatinine levels, things of that nature. But most experienced drug users, and 74% of them are employed, by the way, understand that a lot of drugs are out of your system in 1 to 4 days. And so if they need to get around a pre-employment drug test only, they can figure out how to do so a lot of times. And so that's one reason we recommend to employers that you employ some element of random testing in your workplace as well as pre-employment.
How about medical marijuana? A lot of people are doing that now. So, especially this audience. No, I'm only kidding. No, the baby boomers out there. But really, how about them? What does that employer have to look out for, real quickly?
Well, we view it as any other prescription, honestly. So if you have a job description that is a safety issue, or they would not be able to do the job if they're impaired, then it's important to know that. The issue with medical marijuana is not so much how to treat it, but it's what the impairment levels are. There aren't any standards for what constitutes impairment. And so that's the biggest unknown in the workplace today. So you don't take Benadryl and drive, you don't drink and drive, you don't operate machinery if you take
You shouldn't be getting
narcotic.
stoned and getting and driving too.
Correct. Right. That's right.
Yeah, there's a right place for everything.
Sure.
Okay, now we're going to go to a break. When we come back, we're going to talk further about some of the things that you can do for people, and especially employers. But also, there's people that will come to you that they have to go out of pocket these days, so they can call you for a blood draw. Again, their phone number is 602-892-4599. It's arcpointlabs.com/Scottsdale-North. Welcome back. We're talking with Tim Terrell, and he's the owner of ArcPoint Labs in Scottsdale. Again, tell him the services that you offer real quickly, lots and lots and lots of things, but also the areas.
Yeah, blood draws, immunizations, drug and alcohol testing, food sensitivity testing. We're located in the Scottsdale Air Park, and we'll be expanding to the northwest and west portions of the valley.
Now, we had talked a little bit about, when you were on before, the blood draws, and that anyone can do that, and you said yes, but there's also some specialties that go along with that. Tell us a little bit about that.
We tend to do quite a few specialties that may or may not be insurance reimbursable as well, such as sexually transmitted disease testing. So we do one of those almost every week. One of the trends that we're
still
seeing,
going on. No, it always will. Go ahead.
Well, there's lots of social media dating sites these days, and of course we're entering the tourism season in Arizona, so that tends to pick up. The other trend we're seeing is that more and more older people are requesting this because they may have had a spouse die, or they may be divorced and dating again, and before they take their relationship to the next level, they want to know that each other is safe.
Out there. Right.
So we do that. Something else we're doing more and more of all the time is something called ALCAT testing.
What is that?
It tests to see which foods you can digest and which ones you can't. Sometimes when you eat foods, you may get a postnasal drip or a little wheezing or a rash or other symptoms. It's really a food sensitivity. So we test over 237 foods to see which ones you can digest and which ones you can't. Food colorings, additives, preservatives, molds, environmental chemicals, and medicinal herbs, which we're seeing used more and more.
A lot more. I want to get that straight on that. So this is different than like allergy testing, correct?
Yes, it's a sensitivity. An allergy is when you have kind of an immediate adverse reaction.
So that's not sensitive?
Well, of course it is. But technically, sensitivity really means it's something that bypasses your digestive system and gets directly into your bloodstream, causing your white blood cells to react and causes symptoms.
Now, if they call you and they want to get that, do they need a doctor's order for that?
No doctor's order. About 90% of that is self-pay and it's not reimbursable.
Right.
Because it's a food, not a medication.
Okay. But for that person, though, especially, there's a lot of people out there that are doing those medicinal, the oils and things
medicinal herbs and things. So we're seeing a lot of older women, for example, doing hormone therapy using medicinal herbs. So we can tell which ones work on them and which ones don't work based upon their ability to digest them.
Their phone number is 602-892-4599. It's ArcPoint Labs with an S.com/Scottsdale-North. Okay. Going back to some of these other things here that you have here, did you talk about the telehealth program? What is that?
Well, it's a low-cost way to get health care. So we took several services and combined them into one program. So we took the doctors on the phone, called Teledoc, doctors online, Nurse Line, and a discount prescription card, and rolled them all into one program for $18 per month per household, no consultation fees, no limit on the number of people in the household, and you can call up and talk to a doctor at any time. The first time you call, they take your medical history so that they have it. You can also obtain your medical records from your physician or what you have, and you can upload it into your own portal so they'll have that available. So even people with a lot of routine health care issues can actually call someone and talk to them about any issue. Doctor, nurse, dietitian, fitness expert, doesn't matter, 24/7, 365. If you're traveling, kids going to college, no matter where you are. Or even if your physician gave you instructions and you didn't understand everything he said, you can call someone up and just talk to them about it, get more explanation. So it's very effective. The discount, I have people buying it just because of the discount prescription card, because there's a link. So you can put in your prescription, the number of days of supply, a radius around your house or place of business, and it'll pull up our price for every single prescription within that radius at every single pharmacy.
Can anyone call you in the state for that to your lab?
You can actually go on our website for consumers, and under telehealth, there's a button that says enroll now. So you can do that right on our website, but it works very well. So it doesn't matter if our doctor prescribes the medication or your own doctor prescribes it. You can actually go to the pharmacy with our card, your insurance card, compare the out-of-pocket and pick the lowest cost out-of-pocket and use that card.
That website is arcpointlabs.com/Scottsdale-North. Their phone number is 602-892-4599. Go up on that website and check that. I'm sure a lot of people are ears popping up real big on that one. Can you please also say where it is on the website again?
Yes, at the top under Health and Wellness, pick Telemedicine for Consumers.
Okay. You got to say it for me.
Pharmacogenetics?
Yeah, thank you. What is that?
It tests your ability to metabolize prescription drugs. So based upon your DNA and your makeup, any prescription on the market, there's at least 8% of the population that can't take that prescription because they don't have the DNA to metabolize it. So for some medications, it's as high as 40% of the population can't take it. In fact, there's a lawsuit going on in Hawaii right now. The state is suing several companies because some of the medications offered by the major drug companies don't work on about 40% of people with Asian descent. And so this is meant to take the trial and error out of those prescription meds. And most physicians jump on the chance to help their patients and lessen the trial and error. Myself, I have a genetic condition that causes me to take medication. It took my physician 10 years of trial and error to find the right meds that worked.
It must have been very nice for you to be able to find that out. And a lot of people have had that happen to them.
You find out a lot of things about yourself when you take that test. So
it sounds to me, and I'm listening to you, and I'm going to myself, gosh, I can find out a lot about myself by coming and getting my DNA tested, my blood tested. Do a lot of people that start with you end up going on with more because there's so much they can really find out?
Well, they do. There's we're entering more and more a world of more personalized medicine all the time. As science advances, there's less trial and error. We know more. We can design better health care to fit each individual.
Wow. Now, how about for physicians? Are you helping them in any way? What are you doing for them?
We do about 3 different things for physicians. Some physicians like to use our pharmacogenetics test to help minimize trial and error on prescription drugs. We do medication monitoring for physicians who prescribe narcotics or controlled substances. So we can monitor their patient using either a urine sample or an oral fluid sample and tell if that patient has the right level of medication in their system. Make sure they're not diverting the prescription or perhaps prescription shopping and doubling up on that medication or becoming addicted.
Well, we have less than a minute, so I'm going to try and get this one out. I've tried to get to all of them. But what about prenatal DNA? What about that? You could probably talk forever about it, but what's the fastest way to get that out?
Well, it's an expensive test, but people do that to prove who the father is prior to birth to avoid later expense. So if they can prove who the father is, they can get help with childbirth expenses. There's fewer legal parties involved before the child is born. After, maybe Child Protective Services or other family members may get involved and cause the legal fees to go up. So people will spend more on a prenatal DNA blood test and lessen the troubles that come after the baby is born.
What are your final words?
ArcPoint Labs, we're here to help you. We're a full-service toxicology and clinical laboratory located in the Scottsdale Air Park.
Give them a call. Their phone number is 602-892-4599. whether you're going to get a blood test, whether you have a business and you need somebody to help them with whether it's a candidate resource, evaluation, assessment. I'm going to let you call throughout the rest of the show for that. That's $175 value free to you. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. There's a lot of things that they can do to help you or your employees. Again, it's ArcPoint Labs with an S.com /Scottsdale-North.